Next 21 has 3D fabricating technology for titanium plates and calcium phosphate artificial bones. Forged titanium Ultraflex mesh gives shape and strength to the bone surface. The OCP component, calcium phosphate, incorporates bone marrow internal structures, promoting the invasion of fibroblasts and bone marrow and hastening bone replacement. By stacking and integrating these, it has become possible to reconstruct flat bones, cranium, ilium, sternum, scapula, with autogenous bone, which was difficult in the past. In the structure of flat bone, the medullary layer is composed of trabecular bone and has an open-pore sponge-like structure. In the bone reconstruction of this structure, it is important to incorporate the bone marrow space layer into the sculpting, and promoting bone marrow invasion accelerates bone replacement. Bone graft without a spatial layer of bone marrow invasion is not actively remodeled into autologous bone, or it will take a long time to autogenously ossify. Please see the comparison between the trabecular bone structure of the human skull and the trabecular bone structure modeled by CT bone. The trabecular structure is reproduced in the internal structure of the CT bone by the design method of topological geometry AI artificial intelligence. AI has made optimization design possible in topological geometry. A new composite investment material that is made by suturing and integrating a mesh plate and CT bone into a hybrid. From the origin of its structure, it was named 3D hybrid bone matrix. When the skull reconstruction is complete and the mesh plate is to be removed, cut the sutures over the mesh, remove the stitches. It is a structure that promotes the penetration of fibroblasts and bone marrow into the CT bone by three-dimensionally combining hexagonal inner communicating holes and hexagonal outer communicating slits. For pediatric applications, autogenous ossification can be performed at an early stage, the mesh plate can be removed, and it can grow like the surrounding bone. In addition, the mesh plate does not break even if it is stretched twice. So it may be possible to increase the volume of the ventricle by extending the skull. In the event of a skull defect, it does not simply protect the defect like other bone substitutes. The components of the hybrid bone matrix bone graft change into autogenous bone through metabolic replacement. In order to proceed with metabolic replacement in the same manner as in healthy bones, the bone marrow invasion route is optimized and designed with communicating pores. After the transplantation, we periodically observe changes in bone density and morphological bone marrow structure to monitor the progress of bone metabolism. While confirming, determine when the mesh plate can be removed. Younger patients with rapid bone growth may require mesh plate removal after a period of time. But adults and older do not need to remove the plate. Using a dog, we observed bone marrow invasion and integration with the mother bone when a communicating hole was made in the CT bone as an internal structure. HA-hydroxyapatite bone graft is inactive in bone regeneration and has no internal communication holes for bone marrow invasion. So no bone fusion or bone replacement has been observed over time. CT bone has the characteristics of both osteoconductivity and bone fusion. You can see a lot of intrusion. Bone invasion is also seen in the parenchyma. After 4 weeks, a morphology similar to normal bone with bone marrow inside was observed. The custom-made skull replacement bone graft integrated with a titanium mesh developed in Sweden. 1. Only hexagonal external communication holes cannot create internal communication slits. 2. Titanium mesh is formed by laser sintering, so it is more fragile and easier to break than forged mesh. 3. Since beta-TCP is the main component, it does not have physiological activities such as bone induction, blood vessel induction, and cartilage induction like CT bone. The hybrid bone matrix is a combination device of 2 medical devices with completely different purposes and effects, a custom-made artificial bone and an osteosynthesis plate. As an advantage for the patient, the mesh plate is protected from the outside during the period until CT bone ossifies and acquires strength. The patient can live a normal life and wait for the bone to grow back to normal. In addition, mesh protection prevents the intrusion of soft tissue into the bone structure, that is, accelerates bone regeneration with GBR-guided bone regeneration. Kyocera's fine ceramic skull fillers are strong and stable bone substitute materials, but they do not regenerate bone. It is an inexpensive bone substitute made of PMMA plastic. PMMA is known as a material that absorbs the surrounding bone. Alternative skull material made of HA hydroxyapatite, PE polyethylene, and titanium alloy. All of these are physiologically inert materials and do not remodel to patient's bone. A composite material of HA hydroxyapatite and alpha TCP. Discontinued in 2022.